Hello, everyone. I am Dr. Ginny Sprang, and I am a professor at the University of Kentucky in the College of Medicine, Department of Psychiatry. And I'm the Center Director for the UK Center on Trauma in Children. I've also been the principal investigator of National Child Traumatic Stress Initiative site for about 17 years and am currently the principal investigator for a Category 2 center in the NCTSN called the Secondary Traumatic Stress Innovations and Solutions Center. And so a lot of the work that I'm going to talk about today has come from this work in the National Child Traumatic Stress Network and in this Category 2 center specifically. So there is a scholar by the name of Christopher Shea, and he has done a lot of work looking across a lot of different fields of implementation and describing what the activities of champions are. And so most of this work comes from healthcare, the field of cancer implementation, basically what Christopher Shea says is that champion activities kind of fall into three buckets. So the first bucket has to do with performance indicators. So these are like performance strategies, like problem solving or data-driven decision-making, monitoring, assessment, and maybe mitigating some factors that might impede the uptake of an innovation. Then there's a whole bucket of champion activities called peer engagement strategies. And this is knowing how to engage the right people, persistence, like sticking with something and working it out, and then activities to impact the user's perception of the innovation. And that might be using evidence, it might be using their persuasive skills. And then there are what we call impact actions, and that is the degree to which the evidence-based treatment or practice is used with fidelity, how much penetration in the organization there is with the innovation, and kind of impacting the implementation climate. So bringing in new funding, securing both financial and implementation support from senior leaders. And so this is what Christopher Shea describes as important champion activities. But really, this hasn't been applied to the trauma field in any kind of meaningful or systematic way. So one of the things that I wanted to do was to begin to think about how do these champion behaviors play out in the field of secondary traumatic stress and this goal we have of building secondary traumatic stress informed organizations. So one of the first things that we did is we tried to look across all of the teams, the champion teams that had been involved in a secondary traumatic stress breakthrough series collaborative. And we asked the question, do these organizational efforts that the champions teams are advocating for and spearheading, do they actually impact the levels of secondary traumatic stress in an organization? It's an empirical question. It's something we assumed to be the case, but we didn't really know. And so we set out to investigate this, and we looked across about 6,000 different individuals and organizations that represented over 57 teams. And one of the things that we learned is that, yes, when organizations improve their secondary traumatic stress organizational scores, as measured by the Secondary Traumatic Stress Informed Organizational Assessment, that their overall levels of secondary traumatic stress go down. And that this is seen as something, a function of time. So as time goes on and teams progress in their activities, that scores, secondary traumatic stress will fall. But we also found something very interesting, and that is in those teams where implementation activities were high. This meant that they were meeting a lot, they were coming to all the sessions, their senior leaders were participating in the team's activities, that those teams had more robust changes and that they were sustained over time. And in some cases, they continued to improve even beyond the secondary traumatic stress breakthrough series collaborative that we were engaging them in. But one of the things this didn't tell us is what exactly are they doing. So we were looking at frequencies and attendance and number of sessions that a senior leader came to, but what were the actual activities of these teams? So we did a second study, and in this study, we were basically looking at SHEA's 3 buckets of implementation activities. And are any of these things evident in teams where we had successful outcomes? And what we defined as success is that secondary traumatic stress informed organizational score was improving by at least 10 points, and that the STSS score, this is the individual level of secondary traumatic stress, was decreasing by at least 1 point. Because of different scaling, those differences matter. And one of the things that we were really wanting to focus on is which one of these activities or which combination of activities from the SHEA model were champions doing to make a difference. So we found a couple of interesting things. If we want secondary traumatic stress informed organizational scores to improve, that means that the organization becomes more STS informed. We found that the champions were doing 2 very important things. They were facilitating knowledge and skills in addressing STS, and that is a peer engagement strategy from the SHEA model. And they were using and scaling up PDSAs. Those are plan, do, study, act cycles, small test of change. And so that's also a peer engagement strategy. And there was a contextual factor that was also important, and that is this was especially important in child welfare context. So to become more STS informed, scaling up PDSAs, and facilitating knowledge and skills in their peers. When we looked at what conditions or what strategies are necessary and sufficient to actually decrease the levels of secondary traumatic stress, we found you need to have an STS IOA score that's improved by at least 10 points, and that the champions were engaging in a high level of problem solving. And that's a performance indicator from the SHEA model. So we found that these were specific champions activities that seemed to make a lot of difference. So some lessons learned. Higher levels of implementation activity matters. So meeting together, coming to sessions with content experts and coaches, that matters. The number of small tests of change that a team conducts, that matters. Senior leaders meeting with and integrating with the champions team, that matters. We also found that what champions do matter. It's the specific activities they're engaging in. So spreading knowledge and awareness, engaging in problem solving, and then once they find an effective innovation, an effective problem solving strategy, then scaling up that innovation across the organization. It's not stopping just with one unit or one department. And then another lesson learned is that the champions activities should be tailored to the needs of the organization. Every organization is different. There's no one size fits all. I can't sit here and tell you if you do this, if these champions implement this specific EBT or this EBP, they will be successful. What they're implementing needs to be based on the needs of the organization. It needs to be tailored to the strengths and weaknesses of the organization. And so these champions really need to take a data-driven approach to the work that they do. So, few action steps that you can keep in mind. I'd like to direct you towards our Trauma-Informed Care Champions page that we have on my center's website. The link will be in the video description, so you can follow that. We have a lot of different resources specific to the work of champions. We have some quizzes you can take and some articles that could be of interest to you as you're building a champions team. Also, we'd like for you to familiarize yourself with the science behind champions as implementation change agents. So a link to the articles that I've referenced, both the Shea work and the research that we've done in my center, is also provided in the video description. And then last, I'd like to challenge you to look around for champions. These are early adopters, influencers, enthusiastic change agents, and make sure that you're looking for diversity in role, in perspective, and experience that'll help you build the most robust champions teams.